If your dog has been licking one paw over and over, especially at night when the house goes quiet, I need you to actually watch this video, because that habit is rarely random. Paw licking is one of the most common reasons dogs are brought into an animal hospital, and it can mean anything from a splinter stuck between the toes, to an infection that's already spreading under the skin, to a pain signal from a joint that has nothing to do with the paw at all. I'm Dr. Michael, and in the next few minutes, I'm going to walk you through every real, medically documented reason dogs lick their paws, starting with the harmless ones, and ending with the ones that genuinely need a vet visit. By the end of this video, you'll know exactly what to check for, what you can safely handle at home, and what should never wait until morning. Stay to the end, because the fourth reason is the one most owners get completely wrong. They treat the symptom for months without ever finding the actual cause, and I'll show you exactly why that happens. Let's start with something important. A little bit of paw licking is completely normal. Dogs use their tongue the way we use a washcloth. After a walk, after digging in the yard, after lying in the grass, a few licks to clean off dirt or debris is just basic hygiene. That's not what we're talking about today. What we're talking about is the dog who licks the same paw over and over, who licks until the fur is wet or stained, who licks instead of sleeping, or who licks so much that you've started to worry. That kind of licking is the body or the mind trying to tell you something. So let's go through the real causes, one at a time. Reason 1. Something is physically stuck or injured. This is always the first thing to rule out, and it's also the easiest to miss because paws are covered in fur, and dogs can't just tell you where it hurts. Picture this. Your dog comes in from the backyard and immediately starts obsessively licking one specific paw, not both, just one. That's a big clue. When licking is sudden and focused on a single paw, the very first move is to physically examine that paw yourself. You're looking for a few specific things: a cut or scrape on the pad, a foreign object like a splinter, a thorn, a piece of glass, or a foxtail seed lodged between the toes, a burn from hot pavement, or a chemical like de-icing salt, or a sting from a bee or wasp. Foxtails deserve a special mention here because they're sneaky. These grass seeds have a barbed shape that lets them travel in one direction only, into the skin, and they can work their way deeper between a dog's toes over the course of days, causing swelling and intense licking long after the actual walk where your dog picked it up. This is exactly the kind of foreign body reaction that shows up again later in this video, so keep it in mind. If you check the paw and you see swelling, a wound, an embedded object, or your dog pulls away sharply when you touch a specific spot, that's not a wait-and-see situation. Foreign bodies and puncture wounds need veterinary attention, because trapped material under the skin prevents the area from healing and keeps triggering inflammation until it's physically removed. Reason 2. Allergies, the most common cause of chronic paw licking. If the paw looks physically normal, no cuts, no swelling, nothing stuck, and the licking has been going on for weeks, or comes and goes with the seasons, allergies move to the top of the list. Veterinary dermatology sources consistently identify this as one of the most common reasons dogs develop itchy licked paws, and it actually breaks down into 3 distinct types. Environmental allergies, also called autopy, are reactions to things like pollen, dust mites, and mold, the same triggers that cause hay fever in people, except in dogs the reaction usually shows up on the skin instead of the sinuses. This is why you'll often notice it's worse in spring or fall, or right after your dog has been rolling around in the yard. Flea allergy dermatitis is different, and this one surprises a lot of owners. You don't need a flea infestation for this to happen. A dog can be allergic to flea saliva so intensely that a single bite triggers days of itching and licking, even if you never actually see a flea on your dog. The immune system overreacts to proteins in that one bite, and the itching can be completely out of proportion to how many fleas are actually present. Food allergies are the third type, and they're notoriously hard to pinpoint because they don't usually show up as digestive problems. They show up as itchy paws, itchy ears, and skin irritation instead. The most common trigger proteins are things like chicken, beef, and dairy. Identifying a food allergy typically requires a proper elimination diet done under a veterinarian's guidance, not just switching bags of food at random, since even one accidental treat with the trigger ingredient can reset the whole process. Here's the pattern that ties all 3 types of allergies together. They're almost always accompanied by other symptoms. If your dog is licking their paws, and you're also noticing ear infections, a musty smell, redness on the belly, or hair loss in patches, that combination is a strong signal you're dealing with an allergy rather than an isolated paw problem. And it's exactly this kind of chronic, allergy-driven inflammation that sets up the more serious paw conditions I'm about to walk you through. Reason 3. Parasites. Fleas and mites are next on the list, and they can cause the kind of itching that makes a dog frantic. We already touched on flea allergy dermatitis. But even without an allergic component, a flea infestation alone causes intense itching, and dogs will often direct that itch response straight at their paws and legs. Mange is the other parasite worth knowing about. Demodectic mange is caused by an overgrowth of mites that actually live on dog skin normally, in small numbers, without causing problems, but when the population gets out of control, it leads to itchiness, hair loss, and red, scaly patches, especially on the paws and face. This isn't something you can diagnose by looking. It requires a vet to take a skin scraping and examine it under a microscope. But if your dog's paw licking is paired with visible hair loss or scabby skin, mites belong on your list of possibilities. Reason 4, the hidden cycle, skin infections and interdigital cysts. This is the section 1 asked you to stay for, because it's the one that explains why so many owners feel like they've tried everything and the licking still won't stop. Constant licking makes the paw wet. A wet, warm paw becomes the perfect environment for bacteria and yeast that are already naturally present on your dog's skin to multiply out of control. Veterinary dermatology research has specifically documented that secondary bacterial infection is a frequent complication of irritated licked skin. In other words, your dog starts licking because of an allergy or a small irritation, but the licking itself creates a second problem, an infection, that keeps the itch-lick cycle going even after the original trigger has faded. This general skin inflammation on the paw is called pododermatitis, which simply means inflammation of the paw skin. But there's a more specific and more painful version of this cycle that deserves its own explanation. Interdigital cysts, also called interdigital furunculosis. Here's exactly how they form. When a hair follicle between the toes gets irritated from allergies, from a foreign body, like a grass awn, or from the mechanical stress of a dog's weight and gait, that follicle can rupture under the skin. The body treats the released material as foreign, the same way it would react to bacteria, and mounts an inflammatory response. That inflammation shows up as a swollen, often fluid-filled lump between the toes. And here's the cruel part of the cycle. The swelling itself is itchy and uncomfortable. So the dog licks and chews at it, which damages nearby hair follicles too, causing more of them to rupture, and the cyst spreads or recurs even after one spot seems to heal. Certain breeds are more prone to this because of their coat and paw structure. Short, bristly hair between the toes, combined with excess webbing, has been linked to a higher rate of interdigital cysts, with breeds like boxers, English bulldogs, German short-haired pointers, German shepherds, and golden retrievers noted as predisposed. One specific danger here: never try to pop, drain, or squeeze an interdigital cyst at home. This is consistently listed as the most common mistake owners make, and it can push infection deeper into the tissue rather than resolving it. Diagnosis usually involves your vet examining the paw, sometimes testing a sample of fluid from the area, and in dogs that aren't responding to standard treatment, testing for underlying conditions like hormonal imbalances that can also drive skin problems. Treatment depends entirely on the root cause. It can include managing the underlying allergy, a course of antibiotics, if there's a bacterial infection, anti-inflammatory medication to bring the swelling down, and in some cases removing an embedded foreign body surgically. Left untreated, dogs can actually shift how they bear weight to avoid the pain, which over time can contribute to joint strain elsewhere in the leg. There's one more related condition worth knowing: acrolick dermatitis, sometimes called a lick granuloma. This is a raised, red, often hairless patch that forms from a dog licking one exact spot over and over to the point of creating a self-perpetuating wound. A cycle of self-trauma, inflammation, and infection is exactly how this works, and it's a perfect example of why just wait it out is the wrong instinct with paw licking. The behavior itself becomes the injury. Reason 5. Pain, especially arthritis. This next one catches a lot of owners off guard because it doesn't look like a paw problem at all. Some dogs lick a paw not because the paw itself hurts, but because they're experiencing pain somewhere else in the leg or body, a hip, a knee, a shoulder, and licking a paw becomes a displaced way of dealing with discomfort they can't otherwise express. Arthritis is one of the most common conditions behind this. It's a progressive disease where the cartilage cushioning the joints breaks down over time, and it doesn't just affect big joints like the hips, it can affect the small joints in the toes too. If you have an older dog who has started licking a paw, and you're also noticing they're a little slower to get up, less interested in stairs, or generally less active than they used to be, arthritis deserves serious consideration. This is a case where environmental changes, non-slip rugs, an orthopedic bed, easier access on and off furniture, combined with a vet-guided treatment plan, can make a real difference in comfort. Reason 6, anxiety, boredom, and compulsive behavior. If a veterinarian has already ruled out injury, allergies, parasites, and infection, and the licking still hasn't stopped, behavior moves to the front of the list. Dogs, like people, can develop repetitive self-soothing behaviors in response to stress, boredom, or anxiety. Separation anxiety, noise phobias, changes in the household, or simply not enough mental and physical stimulation can all show up as a dog who compulsively licks their own paw, because the repetitive motion itself has a calming effect, similar to how a person might bite their nails under stress. In more extreme, ongoing cases, this crosses into what veterinary behaviorists classify as a compulsive disorder, a behavior that's no longer just a habit, but has become difficult for the dog to stop, even when you try to redirect them with a toy, a walk, or food. This is a real, recognized condition in veterinary behavioral medicine, and it typically responds best to a combination of environmental enrichment, more structured exercise, and in some cases, guidance from a veterinary behaviorist. Reason 7. Cognitive decline in senior dogs. This last cause is one that almost never gets talked about, and it specifically applies to older dogs. Canine cognitive dysfunction syndrome, often described as the canine version of dementia, is a recognized neurological condition in aging dogs, and one of its documented symptoms is an increase in repetitive behaviors, including licking. If you have a senior dog who has started licking their paws for the first time later in life, alongside other new changes like disorientation, disrupted sleep patterns, or seeming lost in familiar places, this is worth specifically mentioning to your veterinarian, because the management approach is completely different from a young dog with allergies or anxiety. When you should stop watching videos and call the vet, I want to give you a clear, practical checklist, because that's more useful than just being told, "See a vet if you're worried." Contact your veterinarian promptly if you notice any of the following. The licking is sudden, intense, and focused on one single paw. There's visible swelling, redness, discharge, or an open wound. You can see a lump or splayed toes, which can point toward an interdigital cyst. Your dog is limping, favoring the paw, or reluctant to put weight on it. The fur is wet, matted, or stained from constant licking. There's a smell coming from the paw. Or the behavior is interrupting your dog's normal life. They're not sleeping, not eating normally, or seem distressed. Paw licking on its own isn't usually a middle-of-the-night emergency, but any of those combined signs mean it's time for an actual physical exam, not a home remedy. What you can safely do while you wait for an appointment. A few things are genuinely safe and helpful in the meantime. Physically check the paw yourself, get the fur out of the way, and inspect the pads, the skin between the toes, and the nails for anything visible. Keep a towel by the door and gently wipe your dog's paws after outdoor time with a pet-safe rinse or plain water, since this reduces the pollen, allergens, salt, and irritants they're bringing inside and then licking off. If you suspect allergies, note the pattern. Is it seasonal? Is it linked to a new food? Does it get worse after specific walks? Because that history is genuinely useful information for your vet. Inspect between the toes regularly for early swelling before it becomes a full cyst. And if the licking is clearly interrupting sleep or causing visible skin damage, a properly fitted recovery collar can physically interrupt the cycle for a day or two without masking the underlying problem the way that guessing at medication would. What I'd caution against is popping or draining any lump you find yourself and reaching for random internet remedies, homemade topical mixtures, or over-the-counter human products before you know the actual cause. Because a treatment that helps an allergy can do nothing for an infection, and a treatment for anxiety won't touch an embedded foxtail. The licking is a symptom. The paw itself is telling you there's a cause underneath it, and finding that specific cause is what actually stops the cycle for good. The bottom line, paw licking isn't one problem. It's a symptom that can point to 7 very different underlying causes, from something as simple as a splinter to something as significant as an interdigital cyst, arthritis, or cognitive decline. The pattern matters. Is it one paw or all 4? Is it new or long-standing? Is it tied to the seasons? Does it come with other symptoms like ear infections or limping? Pay attention to that pattern, check the paw yourself, and don't let weeks go by hoping it resolves on its own, because the longer that itch-lick cycle continues, the more likely it becomes a genuine infection or cyst that takes real veterinary treatment to clear up. If this helped you catch something you'd been brushing off, that's exactly why I make these videos. Talk to your vet, get that paw checked, and I'll see you in the next one.